It is my great privilege to contribute to this World Patient Safety Day Summit. My apologies not to be with you in person, which I can't do because of the sad loss of Her Majesty the Queen. But I want to thank everyone for their commitment to patient safety, and particularly their commitment to this year's theme, which is the reduction of medication error. When I was Health Secretary in the UK, I was very concerned about this, and 5 years ago, I commissioned the Universities of Sheffield, Manchester and Leeds to do a report to try and quantify the level of harm caused by medication error. I was very shocked when that report arrived and said that there were 700 deaths every year in England alone from medication error. That's 2 a day. But that medication error contributed to 22,000 deaths a year. So many, many more times that. And we know that the root cause of medication error is diagnostic error. Diagnostic accuracy is generally only about 90%. And that means that all of us will experience diagnostic error in our lifetimes. Across the world, the global cost of medication error is estimated at $42 billion. And the forthcoming report that Lord Darzi and his team at Imperial are working on, the Global State of Patient Safety, commissioned by my charity, Patient Safety Watch, has a special section on medication error. So it's a very, very important area. But I also want to thank you all for your commitment to patient safety over recent years. The NHS in the UK is under unprecedented pressure, and the risks to patient safety are therefore increasing. We know when it comes to medication error, there are practical things that we can do. Collecting better data, using techniques like differential diagnosis, increasing electronic prescription, improving staffing levels so mistakes are less likely to be made. But these are also lessons that are important for the entire patient safety agenda, because as Dr. Tedros always says, 5 people die, in fact, not one person, 5 people every single minute of every single day because of a preventable mistake in the way their healthcare is delivered. It remains one of the top 10 killers globally, and it is especially devastating in low or middle income countries where we think just under 3 million preventable deaths happen every single year. So the work you're doing is helping to stop these tragedies that happen every minute of every day and don't require any big new cures or scientific discoveries. They just require better use of medical best practice. So thank you for what you're doing. We're now moving into a post-pandemic phase for patient safety, which means the ministerial summits are restarting in Montreux, Switzerland in the spring. I'll be there. I hope to see as many of you there as possible. But thank you for your great commitment to patient safety. Thank you, Lord Darzi, for being the father of the patient safety movement, not just in this country, but around the world. And please keep up the great campaigning. Thank you very much.